We have a little extra video that we wanted to share with you today, and it's with one of our great friends, Dr. Vincent Pedre.
Dr. Vincent Pedre has actually been like a friend of Goodness Lover for quite a long time. I remember when we first filmed the gut solution and we turned up, he didn't know who we were, and we were like, can we interview you on the gut? And he was like, sure. And so we crammed into his office there in New York City, and as he was talking, like, wow, this guy really knows a lot about the gut. So over time, he's been a fan favorite, and this interview was actually really good. I think one of our strongest interviews that we did in that format.
So when we spoke to Dr. Pedre, the question I asked was, where do you start? Where does one start? What is the biggest needle mover you've experienced in your own life? And we asked this of Dr. Pedre because he is someone that has struggled with gut issues, with mental health issues, and now you would know that those are very much connected. And what he personally did and what he sees as being the most powerful first step for his patients. And so it's a really fun call. I think you'll be thoroughly entertained.
There might be some singing.
Spoiler alert, yes, there is some singing. You'll find out from whom as you
I think they can guess it may not be me, so it's between you and Dr. Vincent.
I don't know.
Maybe.
And we talk about really practical things like how to know if you have enough digestive enzymes and what to do about it. What PPIs actually are doing to your digestive system and how to safely wean off them. We talk about the gut-skin connection. We talk about intermittent fasting. We talk about all sorts of stuff, and it's a very entertaining call. I think you'll love it. Without further ado, let's get into this video. I hope you love it. Dr. Pedre is getting online. We can see him logging in. Hey!
Hey guys. Hey, what's going on with my light here?
Oh, there we go. Yeah.
There we go. Like, I look like a ghost there for a second. I'm Dr. Pedre's ghost.
Awesome. We have 300 people here that are super excited to see you. You're a big star of the series.
Yeah.
And
all right.
Content. And yeah, we're super. Thank you for making your time available to our community.
It's my pleasure. I know we're like on opposite ends of the spectrum here. What time is it for you guys?
It is midday, 12:15.
Midday. Okay. Yeah, it's like the end of my day here. Wow. Yeah. So 300 people on. That's amazing.
Yeah, from all around the world as well. It's crazy.
Yeah.
You know what? I'm really excited. I'm so excited today.
Yeah.
And because I made my first 2 TikTok videos.
And what did you do? Did you dance?
No. I'm following some TikTok influencers and seeing what the style is. And I want my videos to be informative about gut health, like little quick, but also kind of fun and catch your attention. So it's a little, I don't want to give it away because one of them I think is quite funny. So you've got to go to TikTok and watch it.
Okay, we will. All right.
I
don't have an account.
I feel very not true to my age. I'm not on TikTok, but I'm resisting, but I probably need to get on board.
The first one I did is actually on my Instagram stories. So
I'll see you there. But yeah, so everyone, if you're on TikTok, give Dr. Pedre a follow and check out.
Yeah,
see if he truly is as funny as he thinks he is. Oh, amazing. Well, we're so privileged to have you today. I think it would be great to start off with just a little overview of your story, because obviously people here, we actually did a survey for the people that watched the Gut Brain Solution, and most of them watched the series because they had gut issues. So, and obviously mental health is a part of it as well. And I know that your story encompasses both of those things. And we'd love to learn about your story. How did you get into gut health? What was your gut health issue? And what are really the biggest needle movers that you did to fix that in yourself?
Absolutely. My gut health story starts as a child with things that I really couldn't be in control of. My parents, pediatricians, were deciding for me that I had to go on antibiotics for an infection. And then a few months later, antibiotics again for another infection. And I calculated just in the last couple of weeks, I was looking back and thinking during my teenage years, I was on 20 plus rounds of antibiotics, 20 plus rounds.
Wow.
And that decimated my immune system because, for everyone who's watched your series, they should know by now that 70% of the immune system is all along the gut lining. And when you mess with the gut flora, then you're going to really mess with the gut lining. You're going to cause leaky gut that leads to all sorts of immune dysregulation. And for me, it meant my immune system was so distracted with what was going on in the gut because I had developed sensitivities to both gluten and dairy as a result of leaky gut that was triggered by being put on so many rounds of antibiotics. Not to mention, like, part of the reason that I got here today is because I was a type A high stress student getting straight A's because I knew I wanted to be a doctor since I was like 7 years old. So I knew I had to be competitive. And there's a lot of pressure with that. So stress, antibiotics, and then exposure to gluten, all things that lead to leaky gut, inflammation. And I had become kind of like a hypochondriac as a child. Like I was really nervous about being around people who were sick because I thought, well, my immune system is weak. Like I'm going to catch anything. But I didn't know why. The doctors thought, give him a multivitamin. He needs a multivitamin. But no one understood, that it was, and my parents certainly didn't have the background to go outside of Western medicine and think, what could be going on here that's causing these issues. So that was the beginning of my story, and sort of my life quest was to figure out how can I heal my gut? How can I have a stronger immune system? And how can I feel great too? Because the part of my story that I will tell now that I've probably never told is that through my early life and while I was having gut issues, I suffered through bouts of depression. And they came and went. And now that I understand how leaky gut is connected to a leaky blood-brain barrier, and if your gut is inflamed, your brain is inflamed. So when you have an inflamed gut, that can lead to mental health issues like depression and anxiety. And we know that the gut microbiome produces all sorts of metabolically active byproducts, including neurotransmitters that influence our state of being. So of course, if you've been put on multiple rounds of antibiotics and then suddenly you find that you're starting to feel anxious and you weren't an anxious person, or you're finding you've got like mood swings, you have to think, well, something has been disturbed in my gut microbiome that is causing these symptoms. And it took years of healing to get here and understand, like, how did I have to eat to be healthy? Because you guys aren't in Australia. I mean, in the US, we're bombarded with ads for food. And even then, so even if you know what is the healthy way to eat, you start thinking that the normal is like, this is how everybody eats. And there was no concept of that in my training as a doctor. When I trained in Mount Sinai here in New York, they would feed us pizza and bottled water and soda for lunch if we were having a presentation, and everybody was falling asleep. Well, of course, like you're giving us toxic food, like stuff we should not be eating if you want us to stay awake. But we didn't know, all I knew is that I didn't feel well. I was struggling. My energy, I thought, was low because of my training and 100-hour weeks at the hospital. But now looking back, I understand that there are ways that I could have biohacked my body and really changed the way I was eating, worked on my gut microbiome, but I didn't get to that until after I finished my training. And that's where I really like diverged and got into this path, because I realized, wow, this is the, we'll call it the truth that was not revealed to me ever in my training as a medical doctor. And unfortunately, there's so many people out there who don't understand this because they don't understand body physiology. And there's still a lot of people, it's in the common knowledge to go to the doctor and get medication for your woes, without really thinking about what are the long-term consequences of being on a medication. And certainly over the years, like I took medication for acid reflux that alters the pH of the stomach. My mom as a kid used to give me a tincture of opium for abdominal pain that her father, so my grandfather was a doctor in Cuba. And unfortunately, I never got to meet him because of being, political refugees. And we never got to go back before he passed away. But it was a tincture that was very popular to use back in the 1900s for abdominal pain that had a little bit of opium, and it would take away abdominal pain. But what I remember is like I complained about abdominal pain a lot as a child, but no one knew to look for the true underlying root cause of where all of that was coming from.
Wow, what a story. Yes, thank you so much for sharing. And I think it's so indicative of the kind of journey that a lot of us have been on to varying degrees. So I'd love to know, and a lot of our viewers would love to know, how did you heal your gut? What were the biggest steps that you took to heal it, and in what order? I think for a lot of us who have now been exposed to so much great information, it's a little bit hard to know what order do I do this in? What are the biggest needle movers?
Yeah, absolutely. And that's really what I put together in my book, Happy Gut, which is my Happy Gut blueprint for healing the gut that I call my gut care program, which is an acronym for cleanse, activate, restore, and enhance. But it really started with the realization that everything that I thought was not under my control, that I would be destined to living with IBS for the rest of my life, that I would just have a sensitive stomach, that I just had to, be prepared that if I was eating out, that it might not sit right, that I might have to run to the bathroom. And I thought that was my normal, my reality. And the first thing was changing my mindset and realizing that doesn't have to be your normal, and you have more power over it than you realize. So, now that I've been doing this for years, I realized that a change in mindset is really important. And the second thing that is really important, which for years, it's not that I ignored it, but it was always present, and it's something I wrote about in my book, but I think it's way more important than I understood even back then, is what I call the elephant in the room, and that's stress. You've got to mindset, starting to believe, empowering yourself, letting go of the victim mentality, taking control of your eating. So, and even, there's a little bit of victimhood, like if you're not used to cooking, if you're not used to like making stuff for yourself, like, well, I don't know how to cook, I don't know how to do these things. Well, I've gotten my patients to start with just making salads. I'm like, it takes 5 minutes to make a salad. You don't even have to turn on the stove. And it's one way that you can start to take charge of your eating, but really letting go of the victim, realizing that you have more power over this than you can, and you can learn these things, learn how to cook, make foods that are healthy for you, and really dealing with the stress, because you cannot heal the body if you're in the sympathetic fight or flight state. And that is very true for the digestive system, because when you are in the parasympathetic state, you are in that relax and digest mode of your autonomic nervous system. But it's also the healing mode of your body. It's where your body restores and repairs itself. So it's very important to work on those things. And I talk about it in my book: gratitude, affirmations, and even for somebody who's been chronically ill, to start shedding the identity of the illness and not hold that as a part of them, and these steps might be surprising to some of the people that are listening, because maybe they were thinking, oh, start with a probiotic, start doing this. But no, I really do think you've got to start with working on these things. And then, people ask me, what are the top food groups? And the top two that are problematic are wheat, which is gluten, the gliadin protein in wheat that is inflammatory, that increases gut permeability for pretty much everyone because it increases the release of zonulin. And then number two is dairy, because first of all, around the world, it's 75% of people, sometimes 80, 90% of people, like in Asian populations, African populations, are lactose intolerant. But what people don't realize is that that's not the only problem with dairy, that some people are actually sensitive to the dairy proteins. And it gets more detailed and more complex than this, so I'm simplifying.
Yeah.
But even just starting by taking those foods that are inflammatory out of the diet, taking out sugar, getting rid of artificial sweeteners, because artificial sweeteners also feed your gut bacteria, but they feed the bad ones that then cause insulin resistance and make you gain weight in the middle. They do the opposite of what the industry would have you believe, which
they
is
just
crazy.
take the long road to do it.
Yeah, so removing some of the more inflammatory insults to the gut. And sometimes it does mean, like, look, when I think I was just out of my residency, and I was in my New York life as a 20-some-year-old, going out with friends, having drinks, staying out late. And I wasn't feeling well. I was not feeling well. And so I went on a yoga retreat with a friend of mine where we did yoga every day. We meditated every day. We had spa treatments. We were, relaxed by the beach, read a book, got away from the crazy New York life. And at the end of that week, I felt so different that when I got back to New York, I enrolled in a yoga teacher training. And I told my friends, you're not going to see me for a little while. I'm not going to go out. I started shopping all organic, cooking my own food. And within 2 weeks, I felt a dramatic shift. And I started meditating with my yoga training. And it was about 6 weeks later, I went out and met my friends again. And the first thing they said is like, what did you do? Like, you look different. You look like exactly. Like you had a makeover. I basically, I had a mind, body, spirit makeover by, taking control and taking charge of my food. So that's number one, important mindset and feeling empowered that you have more control over this than you think. Take out the paternalistic Western model that the doctor is here and he's going to save you with a medication. You take this medication and that's all you have to do. You just have to be in receiving mode. No, you have the power as the patient to be your own healer by what you choose to do. And we know, since we're also talking about mental health, that those medications for mental health, like antidepressants, like SSRIs, were shown that they actually tweak the numbers in the studies. And in the end, they were 50-50. They really, their success was a coin toss.
Yeah.
But the problem is that most people want the easy pill. Because this path, it does take some work. It does take a little bit of, like if you ever did chemistry, if you're reacting two elements together, it takes sometimes you have to put more energy into it and it has to get through this energy hump and then the reaction goes through. It's the same way with getting started with new things in your life. You know, it's going to feel uncomfortable. It's going to feel strange. It's different. And it's going to be, you know, you have to develop new habits, but you have to push yourself through that. And if you can start with little steps, you know, my book is about doing everything at once, but I recognize that some people, they can, you know, if they try to do everything at once, they're going to feel overwhelmed and they could fail. So I say, okay, 1 week, take out all gluten from your diet, you know, and if at the end of that week, you still feel like you're struggling with it, do another week. Then after that, take out dairy from your diet. So master one thing at a time.
Yep.
And stack them in. So you master one thing, then you stack in the next thing, then you stack in the next thing. You know, then we want to talk about, like, do we need to cleanse the gut? Have you been on rounds of antibiotics? So maybe you need to go on some antimicrobial herbs for a month to kind of clean out the slate. And then after that, you know, you also want to see, are you digesting food properly, or does food sit in your stomach for a really long time, or it just feels like you get bloated after you eat? So maybe you need digestive enzymes to help you. And I describe that as like, if you hurt your knee and you need to use a knee brace for your knee to heal, well, digestive enzymes are like a knee brace for your digestive system. They give your digestive system a break so it can start to heal itself and heal the lining. And then maybe you need to take some sort of combination powder to work on that leaky gut, because most people out there are suffering from leaky gut. And if you have mental health issues, you have leaky gut. If you have skin issues, eczema, adult acne, hives, psoriasis, you have leaky gut. If you have migraines, if you have allergies, if you have asthma, if you have autoimmune disease, you have leaky gut. So you need to work on leaky gut, and that's both mind, body, spirit, but also, you know, using the right types of nutrients like slippery elm bark, marshmallow root extract, DGL, which is a form of licorice that doesn't raise your blood pressure, aloe vera, L-glutamine, the most abundant amino acid in the body that also happens to be the primary energy source of the cells that line the small intestine. And this is not like, this is real science. Like, this has been studied and shown that it works. And then of course the microbiome, and maybe it means taking probiotics, but it also means like really looking at your diet and seeing, are you getting enough fiber? And is that fiber in both insoluble and soluble forms? Insoluble being like roughage, like greens, things like that. And soluble fibers being like gluten-free oats, things that, and some foods have mixes of them. So if you can tolerate nuts, seeds, they have different types of fibers in them. And really it's about doing things in the order that it's going to support you the best. But if you don't change this first, then it's very easy to fail in the other steps.
Yeah.
And then I find that after you work on your mind and affirmations and gratitude and realizing you've got the power to do this, just a stepwise fashion, changing the diet and really conquering things. I mean, once you conquer sugar cravings, things like that, like refined carbs, like the person, once you get to a certain point, you start to feel so empowered that you just want to keep going. And that's what I've heard from people who have done my 28-day program in my book, that once they get to the end of the 28 days, they're like, well, but do I go back to eating how I used to? Because I feel so good now. And really the answer is, you know, be intuitive about it.
Yeah.
Obviously, if you discovered in the process that there are certain foods that just bog you down, then why are you going to do that to yourself? But I mean, sometimes I think I'm just a body whisperer for people. I'm not a doctor. I'm just a body whisperer, and I'm telling people what their bodies are trying to communicate with you. It's like, knock, knock. Hey, when you eat that, it gave you a headache. Maybe you shouldn't eat that. No,
So
I know
true.
it's not. I know it's not as simple as that.
Yeah.
You know, sometimes sometimes it's really hard to figure out. Like I
Yeah.
had a patient who was having chronic migraines, and we did food sensitivity testing. And this is something, another important thing for the audience to realize, like, look, you have a lot of power, but sometimes you might hit a roadblock
Yeah.
where you might need additional guidance from a
Yeah.
health practitioner, functional medicine health practitioner, a nutritionist, someone who can do additional testing.
Mhm.
And with this patient, we did food sensitivity testing because we had done a lot of things and her migraines were still not going away. Turns out she was reactive to cinnamon that she was putting in her gluten-free oats that she had every day.
Wow.
Took out the
Whoa.
cinnamon, and her migraines dropped by 50% within like just a couple of weeks.
Wow.
So, and we wouldn't have known that without
Cinnamon's
food
not at the front of my
sensitivity
mind.
testing. I mean,
Of all the
who would
culprits,
think, like,
cinnamon.
Yeah.
cinnamon. Oh God, it's one of my favorite spices. I would be so upset if I couldn't eat
Yeah.
cinnamon.
Yeah.
Awesome.
Oh, what good stuff. That was fantastic. And I
Yeah.
feel like it's just
A lot
so
of questions would be answered if you
Yes.
just followed that.
Yes, exactly. Exactly. We don't need to
I'm usually
overcomplicate it.
like that. Like I take one question and I probably answer like 5 of them at the same
Yeah.
time.
No, it's fantastic because before you got on, we were just talking about stress and that's in our week 1 is like, let's talk about stress. So that was
See?
perfect. It's like we had a little
and
power
I
hour
didn't even
before
know
this.
that.
Yeah.
I'm just tuned in.
The whisperer.
The whisperer, the ghost.
Yeah, the ghost. Yeah, you were white at the start.
Awesome. So we have some more questions about leaky gut. Realistically, how long does it take on average for a person to heal from leaky gut?
Ooh.
I know there's a spectrum there, but
That's an awesome question. And let me start by saying that there is no perfect test for leaky gut.
Mm.
The testing that we have for leaky gut are kind of like Plato in the cave, like what writing about the shadows. It's like we're not looking at it directly. We have a test that is called a lactulose mannitol test that's based on the fact that lactulose is a bigger size sugar and mannitol is a smaller sugar. So if you have leaky gut, lactulose will get through more easily, so you'll see more of it in the urine. And if you recover more lactulose in the urine, and if there's a certain percent that we look for, then you might have leaky gut. But I've also seen patients who test negative with that test and still have symptoms of leaky gut. There's other tests that you can do, like there's a lab here in the US that has been looking at this, and it's an immunology lab, and they look at things like antibodies to zonulin, antibodies to the different tight junction proteins. So the tight junctions are the Velcro-like connections, the protein structure that connects the cells to each other. And when your gut becomes leaky, it just separates like that. And then it allows, for space between the cells, that then allows things like gluten proteins, corn, soy, other things to get through, and your immune system reacts to them. So, we still don't have perfect ways to test for leaky gut. You can also test for zonulin. And again, zonulin, for anybody who's listening, is that dimmer switch that controls the permeability of your gut. So if zonulin is high, your gut permeability is high. If zonulin is low, the tight junctions are tight. But the other interesting thing that I was investigating recently is that if you have SIBO, small intestinal bacterial overgrowth, then you can have leaky gut without a rise in zonulin and without the tight junctions becoming loose. And it's through another mechanism, because some of the bacteria that might cause small intestinal bacterial overgrowth produce cytolethal distending toxin, CDT. And they found that cytolethal distending toxin that comes from things like E. coli can increase gut permeability. And you might find antibodies to this as well. But again, we're not, the real test would be an endoscopy with an ultrasound, endoscopic ultrasound, where they can look at the lining itself really close up microscopically. And obviously you can't do that with people, but if you have a lot of food reactions, and if you had any of those symptoms that we're thinking about, then you most likely have leaky gut. So you've got to bring me back because I just went over here.
That was good.
Over here. And now
Then back
remind me
again.
what the original question was.
How long does it take to heal?
Oh,
How long?
Yes. How long does it take to heal a tennis court size of gut lining? Oh my goodness. Honestly, I've seen it take anywhere between 3 months, 6 months, a year. It takes a lot of patience. And the thing is, if you're in healing and then look, life happens and you have a dental procedure or you've got a dental infection and now you have to go on antibiotics. Well, guess what? It's going to make you take a few steps back, or you're under a lot of stress, and stress is like an attack on your gut and it increases gut permeability. So when you're working on healing leaky gut, what I want people to understand is not only do you want to take those gut healing powders that have been designed for leaky gut with the nutrients that I mentioned, but you've got to work on mindfulness. You've got to work on stress reduction, if it's breathing, yoga, because all of that is going to help seal the gut lining, work on vagal nerve activation. So for anybody who doesn't know what the vagus nerve is, it's probably the biggest center of your parasympathetic nervous system, and it comes from the brain down through here, and it wires your heart, your internal organs, and your entire gut. And when you lose vagal tone, you lose digestive enzyme production. So you'll start feeling like if you've been really stressed and then you eat and that food sits in your stomach like a rock. Well, that's because you're stressed and you're losing vagal tone. Now, what they found, and this is really interesting, with patients who have traumatic brain injury, it causes immediate dysfunction of the vagus nerve. And because of that, within 30 minutes of traumatic brain injury with loss of consciousness, you have an increase in gut permeability and inflammation. And it's all being controlled through the vagus. So, that's just to emphasize how important the nervous system is a key factor in regulating gut permeability. And you can activate and improve your vagal tone by doing something that your family members or your loved ones might be a little bit annoyed with, but hell, you could do it in the shower, just sing,
I was hoping
really
we'd
high
get another
voice, or do
example.
Or an om with nice vibration here, or like a humming exhale breath, or you can gargle. So things that cause vibration in your neck are going to activate that vagus nerve and get you into that parasympathetic tone. And something that I'm doing, I don't know if you realize, I'm wearing this band here.
Is that a Whoop?
It's a Whoop.
Yes.
Yeah.
Twinsies.
Oh my gosh. I just got this. And so you have a Whoop, so you know that it looks for heart rate variability, and that's part of like your recovery. And if your heart rate variability is high, it means that there is really good balance between your parasympathetic and your sympathetic nervous system. And if it's low, it means that your parasympathetic and sympathetic nervous systems are in balance, and you might have more of an incoherent heart rhythm, which is where gratitude comes in. Because if you're meditating with a sense of gratitude coming from here, that feeling helps your heart get into a more coherent rhythm, because there is an intelligence to your heart. Now we know that there's a heart brain, there's a gut brain, so we have the second brain, the third brain here. So it's really important to not neglect this part of the picture when you're healing leaky gut. And I think it'll take longer if you think, well, I'm just going to take a leaky gut powder and do the diet and all that, but I'm going to continue to live my type A stressed out lifestyle, running from here to there, eating at my desk at lunch, not stopping to rest. Again, you can out supplement, you can out diet a stressed out lifestyle.
That's great.
It's the other pillar that you have to pay attention when you're healing the gut. You cannot bypass that.
Well
Word.
said. Well said.
Mic drop.
Don't drop your mic. We need to hear some more singing. That's fantastic. Thank you so much. Speaking
I
of
could
the
serenade you in Spanish.
Ooh, we'll have to sign off the call with that. We have a question here from Barbara. In light of the vagus nerve, and you mentioned digestive enzymes, she is asking, I would like to know, if we take digestive enzymes, how will we recreate enzymes naturally so eventually we can get off these enzymes? I'm still unclear on the process.
Yeah. Again, think of the digestive enzyme as kind of like that splint that's being used to allow your gut to heal. So, the same way, like if you use the cane because you hurt your knee, and you're not going to use the cane forever, you're just going to use it while your knee is healing. In the same way, you're using digestive enzymes, but you're doing a comprehensive approach, I hope, like my Happy Gut Blueprint, my gut care, so that you're not just taking digestive enzymes, you're doing everything else that we talked about, because you need a healthy gut lining to produce digestive enzymes and to communicate with your pancreas. A lot of people that I see have pancreatic enzyme deficiency. And you would think, do you think that's a pancreatic issue if there's a deficiency of pancreatic enzyme? Let me ask you guys, is it a pancreatic issue or is it a gut lining issue? Where's the problem? If you have pancreatic enzyme deficiency.
I'm guessing gut.
Both?
Oh, both, yeah. Is there an all of the above? Like, is it A, B, or C? Maybe
putting you on the spot.
A. A is gut. I'll go A, maybe.
It's the gut lining, because you need a healthy gut lining to send the signal to the pancreas to secrete its enzymes into the gut. And it's mediated by a hormone-like signal called cholecystokinin. And there's other signals, because all throughout the gut, it's about 2% of the gut cells are what they call enteroendocrine cells that produce all sorts of hormonal-like signals. And they also happen to have serotonin receptors. They have 5-HT2 receptors, I think they are, that are sensitive to the hormone serotonin, to the neurotransmitter serotonin, which is your happiness molecule.
Wow.
Yeah, that's amazing.
Interesting.
That's so cool. Awesome.
So many bombs dropped. Okay. Lucy is asking on the topic of enzymes. What if enzymes upset your stomach? Do you keep trying or stop taking them?
If enzymes are upsetting your stomach, you have to think it could be the enzyme preparation. It could be the enzymes are too strong. It could be that they're the wrong combination of enzymes for you. And this is where it might need to go to higher level, where you start working with a functional medicine practitioner or naturopath that really understands enzymes. It can be very specific to, you might be good with enzymes from one company, but enzymes from another company maybe have too much of one thing that bothers your stomach. And not everyone needs this, but a lot of people do. They need betaine HCl. So it's not really an enzyme, it's hydrochloric acid to increase the acid inside the stomach. But for people who are really sensitive, instead of giving them enzymes, I might just give something that's been used for the ages to help stimulate enzyme production, like digestive bitters, or even just a small dose of apple cider vinegar before they start eating a meal to get those enzymes going. So, it's not a one size fits all. And, you know what they say, like when you keep trying the same thing but get the same result, it's insanity. So, same thing, if you think enzymes should be good for you, but you keep trying them and they're not working, then they're not right for you. So you have to look for the next solution. And maybe you need something gentler. Some people's bodies are super sensitive. And with those patients, I always work more gently on ways, how can we stimulate enzyme production, or even just get them into a more relaxed vagal tone state in which their body is in a better state to digest, or even like stopping and taking deep breaths for like a minute, 2 minutes, 3 minutes, maybe 5 minutes before they start eating, just to kind of shift that internal environment. Because I know a lot of people now working from home, and there's no like there's no break between work and eating lunch. So you have to think about creating a ritual. You've got to insert certain rituals that might be just stopping and taking some deep breaths, being grateful for what you're about to eat, and that shifts your internal state so you can digest better. So the important thing to understand is that we're not black and white, we're all shades of different grays, and you have to really listen to your body when it comes to that.
Great stuff. Awesome. This has been a great call so far. I'm loving it. Thanks
You're
so
on fire,
much.
Dr.
Yeah.
Pedre.
That TikTok thing just has really put you in a great zone.
I've come a long way since you guys first met me.
Oh, so great. We've known Dr. Pedre for like 2.5 years now, I guess. It was when we first filmed the gut solution, and we got, it was Dr. Maya Sheetry that actually we were in New York, and we were like, do you recommend anyone? She's like, oh, you should talk to my friend Vincent. And so I'm so glad that she said that, because it's been fantastic knowing you. You've been such a valuable, you've contributed so much valuable content to all our series, and we just really like you as well. I think I said that after our first interview. I was like, thanks so much, but I really like you, by the way. I think you're great.
Oh, I like you guys too.
Yeah.
100%.
Awesome. We have a question. So obviously we're starting with mindset. That's the most important thing, reducing stress, bringing ritual back into our body, getting that foundation right. And once we move into the food side of things, changing that lifestyle, I know that a lot of people, we know in theory, a lot of good foods, obviously, that are good for the gut, plant foods, all these great, nutritious, nutrient-dense foods. For a lot of us, introducing that's great. We feel great straight away. But for many of us, when our guts aren't ready for it, they're not feeling great. So a question here is, how come all the foods that are so great for me make me feel so bad?
Well, the one thing that comes up for me is like, everybody thinks of eating raw as being something super healthy and really great for the body. But what I've found in patients when their gut is really disordered, they've got leaky gut, maybe they need some gut healing, parasites, things like that, and they're not producing enough digestive enzymes as a result, it's very difficult to break down those plant cell walls. And so another way to think about things is that when you cook vegetables, it's like you're doing some of the work of digestion outside of your body. And for someone who's having a lot of difficulty digesting, I would start strictly with only cooked vegetables, no raw vegetables allowed at all, until I know that we've achieved enough gut healing and we can start to test little by little, introducing some raw foods into the diet. Because the typical thing is they'll eat a salad, and within minutes of eating the salad, they feel like they're ballooned and they've got to loosen their pants, or they feel like they look pregnant and they're all bloated. And that's just a sign that you're not making enough digestive enzymes, and maybe you're eating too fast. But also those plant cell walls are really difficult to break down. So either digestive enzyme support. But that's one example. The other example is people who, whether you're vegetarian, vegan, or maybe you're a meat eater, and say you eat a hamburger or a steak or whatever, and then it just sits really heavy in your stomach and you feel uncomfortable. And part of that could be food combining, but a lot of that could be a sign of low stomach acid. And in those cases, then you have to start taking some betaine HCl with meals to help assist with digestion and modify the diet. Maybe not starting with heavy meats, but more light fish, maybe some salmon, and then slowly moving the diet along. So I hear the frustrations. The other thing that can happen is that you might be able to tolerate a certain amount of a healthy food, for example, of avocado, which are high in fiber. But if you've got a certain level of bacterial overgrowth in your gut, then if you eat too much avocado, you're going to feel ballooned. You're going to get bloated. However, you might be okay if you just eat a quarter of the avocado, small amount. And that's another thing to realize is there could be threshold issues. So it might not be that you don't have to fully cut the food out, which can feel really restrictive, but maybe just trying to reduce the amount that you eat and then testing and seeing how you feel. The biggest triggers are garlic and onions. Those can be, really gas producing for people who have stomach issues.
Yes. Okay. Fantastic. So good. That was super helpful. Thank you. Should one take HCl before weaning off PPIs?
Great question. So I had a case with that, a patient who I was weaning off of a proton pump inhibitor. And for anybody who doesn't know what that is, a PPI is a type of medication that blocks the secretion of hydrochloric acid by the parietal cells in your stomach. And I made a presentation about this, and I'm just going to put the image in your head.
Okay.
Like when you take a PPI, it's like you're building a dam, and on the other side of that dam is all the hydrochloric acid that wants to come out, and your body actually causes a hypertrophy. So it starts multiplying parietal cells, but they're all being stopped. So you basically have a dam of hydrochloric acid. So if you stop taking the PPI, that dam breaks down, and guess what happens? All of that acid comes rushing in. So when people try to get off of PPIs and they say, well, I can't get off of it because I tried stopping it, but then all my symptoms came back. Well, yeah, because taking the medication just built this dam that held all the hydrochloric acid on one side. And once you took away, it's like you opened the dam by stopping the medication, then you got this rush of acid. So you have to wean the PPI slowly. And the fact is that the PPI is lowering your stomach acid. So in other words, it's raising the pH, it's making your stomach more alkaline. And what that does, which is really important in connection to mental health, is that it decreases your ability to break down protein. And you need to be able to break down protein into amino acids to get the building blocks of neurotransmitters like serotonin, which is your happiness molecule, or dopamine. So if your stomach acid is low, then that can lead to a whole cascade of problems, including mental health issues. So you have to do a slow wean. And in the cases that I've worked with people, I have introduced betaine HCl slowly with a protein meal. And you take it close to the meal. You don't want that hydrochloric acid sitting in the stomach for too long while it's empty. You want to put it in there, and no more than 5 minutes later, introduce the food, because you can cause some discomfort and burning. And as they gain confidence and you're able to, feel that you're digesting better, reducing the PPI, sometimes what I'll do, and obviously this is kind of higher level stuff, don't try this on your own, work with a health practitioner. That's my little disclaimer, because it does get complicated. Sometimes as I'm tapering the PPI, I might introduce an H2 blocker, which are readily available. I don't know if they're over the counter in Australia, but you can buy them, over the counter here in the US, as well as PPIs now. It's crazy. But they're weaker. They don't block that parietal cell in the same way. So I sometimes use them as kind of a bridge. I'm bringing down the PPI. I bring in a little bit of an H2 blocker, and I'm using the enzymes to improve digestion and making sure that they're eating at least finishing eating 3 hours before they go to bed. So they have enough time to digest food before they lie down at night to prevent acid reflux. However, I have some patients that need 4 hours, and I have some that need 5 hours. So don't just think like 3 hours is enough. If you're still getting symptoms, like, again, intuitive, listen to your body. Maybe you need to eat dinner earlier and wait more hours before you lie down and go to bed, because the biggest amount of reflux tends to happen at nighttime if food hasn't been completely digested, and then you lie down and just you're in a position where that stomach acid can come up into your esophagus.
Great answer. Thank you so much. I've noticed on your social media, we follow. Hey? What's that?
By the way, since I just thought of this, because I'm drinking water, if you can avoid it, don't drink water while you're eating because it's going to dilute your stomach acid. So drink water between meals. Try to not drink too much water during a meal or any at all. And if you find that you're kind of like choking with your food and you need water to bring it down, well, guess what? You're chewing too fast. So slow down.
That's great. Love it. I noticed on your social media, Dr. Pedre, you're talking a lot lately about gut health and skin health. And we actually had quite a few questions come in about acne and psoriasis. And we know that like your skin is a reflection of your gut health, but is there anything else you'd like to add to what we've already been talking about? You clearly have a good gut. Look at that radiant skin. But is there anything else that you would add specifically to acne or psoriasis that isn't already covered in just gut health principles?
Well, with acne, you have to also consider all the different topical remedies and the pH balance of the skin. That's really important. And a lot of dermatologists put patients on antibiotics as a treatment for skin issues, or teenagers are put on Accutane to clear up their skin, which does have some antimicrobial properties. And I was researching, there seems to be the potential increased risk for ulcerative colitis, which is an inflammatory bowel disease, in people who have been on Accutane. But the studies aren't completely clear. But obviously the foundation for the skin is the gut. It's the diet, but it's also stress. I've had female patients with adult acne that were highly stressed out, and even after cleaning out the diet, maybe the acne reduced by 50%, but still getting acne. And it was the stress of working a full-time job and going to night school, something like that can also be a trigger. But really looking at the food triggers, greasy foods, chocolate, sweets, desserts, dairy, all those things tend to be acne triggers. Wheat even could be a trigger as well, or just too many refined carbohydrates. And actually on my Facebook Live this past weekend, I was demonstrating a do-at-home remedy that costs very little and is really great for exfoliating the skin. And pH balancing the skin on the face. And it's basically just taking aluminum-free sodium bicarbonate and some apple cider vinegar and a cotton pad. And you just wet the cotton in the apple cider, then dip it in the sodium bicarbonate, and then you use it in circular motions, and it takes off the dead skin cells that might clog your pores. So really important. And it can also pH balance the face. If you're doing stuff like that and making sure your face stays well hydrated, making sure you're drinking plenty of water between meals, and working on your gut health, then you're going to have beautiful, radiant skin. And that's the thing that I've heard as a compliment from people who have done my program. And since I've been posting about skin issues, I've had people write in on Instagram and tell me, like one said that her rosacea, which she was told that she would just have to live with and take topical remedies, when she discovered my book and followed my program, it disappeared and never came back. So again, the skin is a reflection of the outside. And I kind of came up with this idea of calling the gut your inner skin. So if you want your outer skin to look beautiful, you need to take care of your inner skin, which is the gut lining.
Awesome.
Good. I like it.
It's amazing how massive the skin industry is, and it's all focused on like outer treatments and not dealing with the root cause. So good.
Yeah. Okay. Did you see? I'm scrolling through trying to figure out what is the next logical question to ask in the flow of what we're talking about. Okay. Let's see. Okay. So
many great questions.
There's so many great questions in here. Thanks everyone for sending them through. Okay. So what are your thoughts on intermittent fasting?
Ooh, really great question. That's another thing that is really important to talk about in terms of gut health. And I probably didn't talk about it enough in Happy Gut, but it became more of a kind of a thing after my book was published. But as important as it is to know what to eat for your gut, it's also important to know when to not eat. Because when you give your digestive system a break, you're allowing for inflammatory markers to come down. You're allowing the gut that time period it needs to restore and repair itself. And so, for gut healing, intermittent fasting can be a really key important part of it. And sometimes it's the way to get rid of excess bloating that's being triggered by meals. And it can be done in many different ways. The simplest way is to try to do a 12-hour fast that starts after you finish eating dinner until the next morning. So say you finish eating dinner at 7:30 at night, then you're not going to eat again until 7:30 the next morning. And it really makes you have to be super responsible about how you balance your macronutrients and making sure that at dinner that you're getting the right combination of protein, complex carb, and healthy fats so that you can get through the night and not feel hungry. Because a lot of people sometimes when they start doing intermittent fasting, they might find that their sleep is a little bit disturbed because their bodies were so used to having that late night snack that you have to kind of get over the hump. And what I've done for people when they feel that is sometimes as a little bridge, as they're getting used to fasting overnight, I'll have them drink an herbal tea, like a relaxing, calming tea. And even if, at the beginning, when they're still kind of getting used to it and maybe their bodies are going to feel a withdrawal from calories, and have them put a little bit of honey, like raw honey in the tea as a way to just kind of help them get through the night. And eventually what you find is that they find they don't even need that. And they get really good at the overnight fast.
Mm-hmm. Okay.
Excellent. Is there any
And
consideration?
by the way, I do also want to add, because sometimes a lot of people, and especially now people working from home, can easily graze throughout the day. Mm. And that's not necessarily good for your gut, because your gut bacteria has a circadian rhythm, and that circadian rhythm is dictated by yourself. And it's dependent on your sleep, but also it's dependent on when you eat. So if you're the type that eats at irregular hours, so maybe one day you have lunch at 12, the next day you do at 2, the next day maybe you're too rushed and you just have a green juice at 1, you're constantly confusing your gut microbiome, and that can cause some imbalances there. So, but the other thing to know is that it's important to fast in between meals so that your insulin sensitivity can reset itself. So instead of grazing throughout the day, and I've worked with patients on this, is, now that everybody's working from home, is just having discipline. Like the kitchen is closed in between meals. Have your breakfast, have your lunch, maybe an afternoon snack, like a high fat, maybe some nuts, something like that, and dinner. But really try to stay away from just kind of grazing all day long.
Fantastic.
Excellent. Is there any considerations with intermittent fasting? We had a question come up in the group about that and menopausal women. Could be any things to be aware of there?
There's a consideration with women and intermittent fasting and what their bodies can tolerate, because intermittent fasting for men is different than women. Men can tolerate a longer fasting window, whereas women have to be a little gentler with their bodies. It could actually increase cortisol and stress if you fast for too long. So for women going through hormonal fluctuations at menopause, where they can sometimes get cravings, it might be really important to break that fast in the morning and have a protein breakfast with some fiber like vegetables and a healthy fat, avocado, to just keep those blood sugar levels steady and not add more stress to the body.
Excellent. Awesome.
Thank you. I'm wondering if you could just, as we're wrapping up, it's been an hour since you joined the call now. I'm wondering if you, since you do have access to this Q&A, would you be able to do a rapid fire, just like scroll through here and just answer like rapid fire? Remember when Olivia did this? She was like, go, go, go. But
Oh my
see
gosh.
if you can just
Okay,
like
let's see.
whiz through a few ones that we didn't get to here. A few.
Okay, I'm just gonna go through.
Go.
Is erythritol affecting insulin production as well? Well, erythritol is a sugar alcohol, and for some people who are sensitive to FODMAPs, fermentable oligomonosaccharides and polyols, they are sensitive to erythritol, and it can make you really bloated. So I don't know if you saw, like, a lot of the health bars started coming out with erythritol, and they would cause a lot of bloating. Well, they're also causing fermentation with your gut microbiome, and these false sugars could potentially lead to things like insulin resistance as well. So it's really something to watch out for. I don't personally like a lot of erythritol in products because I found that patients who were having it were like really bloated. I'm like, okay, this is not right.
Okay. Thank you.
Let's see what else. The workbook talks about live probiotics. What about spore-based probiotics? Well, spore-based probiotics I found to be really useful in certain circumstances, and especially when I was caring for patients with small intestinal bacterial overgrowth. The spore-based probiotics play a really important role in regulating the gut microbiome, because they do a couple of things. They have one thing that it's called quorum sensing, so they kind of sense each other and they can group together. And then the second thing that they do is they produce these antimicrobial peptides that are like antibiotics, so they can kill off other bad bugs in the gut. So yeah, I mean, the thing about them is they're not one size fits all, and some people do really great with them, and some people, you start them on them and they feel kind of sick. And that's something to know, because the doses for a spore-based probiotic have to be much lower in strength than what you would use for a live probiotic, because they do seed the gut and then they germinate. So if you ever try a spore-based probiotic, you have to know, like, the probiotic is safe whether it's inside or outside the capsule, because it can't be broken down by stomach acid. It's in a spore, and it doesn't germinate until it gets to your large intestine. So sometimes I've had patients open capsules and empty part of it, or get those vegetable capsules at the supermarket and then transfer some of it there, so they can even take a smaller dose if the one capsule is too much for them. And that's always something to know. That's a little pearl, that if something feels like too much, it could be that you just have to lower the dose, and the capsule dose might be too big. And you can do that yourself. They easily sell vegetable capsules that you can just transfer. You know, you have to do your little science experiment at home.
Great.
I'm going to go to the next one from Lisa. Do you recommend stool testing for Candida or treating based on symptoms? Okay, so stool testing for Candida is really tricky because a lot of times it comes back negative. You can do a stool PCR, but even that, a lot of times I find they don't test for a broad enough range of different yeast. Not all yeast that causes problems in the gut is Candida. It could be different types of yeast like Rhodotorula, Geotrichum. So sometimes, yeah, treat based on symptoms. I also will occasionally do an organic acids test and look for arabinose in the result, a high arabinose sugar, because that tends to be related to Candida. But again, not every test is 100% proof. And what I tell people is treat the patient, not the test. You always treat the person, because what they're presenting with might be different from what the test says. So, ooh, it scrolls up really fast. I was looking for the next one.
See, it's not just me.
And it was like, whoa. Have you seen certain strategies work with younger children, 8-year-olds, with leaky gut, when the ice cream truck is constantly at the playground and their friends eat on a regular basis?
Wow.
Oh my goodness.
So bad.
Well, I had this issue with my son. So when he was 5 years old, in kindergarten, he started misbehaving. And we asked the teacher, like, you know, it was a new school, like maybe it's the change to the new school. And you know, then we started asking her, like, well, is he misbehaving before lunch? Like maybe he's hungry, like maybe we need to feed him more before he leaves home. And then she couldn't tell us. But what we were doing at the time, we had been a gluten-free household, but we had started giving him sometimes sandwiches for lunch that were wheat-based. And I wasn't aware that he had a gluten issue yet. But I told my wife at the time that, look, you're going to have to trust me on this. We're going to take gluten out of his diet. We're going to start packing different lunch. We did that. And within 1 week, his behavior improved. His tantrums went away. He started listening to the teacher. It was really dramatic. And I think when kids see that they improve with a dietary change and that they don't have abdominal pain and they feel better, then you can get them on board. But I'm also, you know, and it's tough with an 8-year-old, but I'm also a big believer in Socratic style learning. And that means, you know, like if we went out to a restaurant and he was adamant and he wanted something, like he wants the burger on a regular bun, I'm like, okay. And then I would ask him, how did you feel after that meal? Oh, my tummy kind of hurt. And like, I wonder if it was the bread. Maybe the bread bothered your tummy. It's like, and after a while, we would go out and he would choose gluten-free on his own. But I let him have the experience, because the best teacher is the experience with the questions that allow your child to make the connection, you know, so you're helping them make that connection, but you're not telling them, which sometimes, you know, children like to rebel, but allowing them to discover it themselves so then they can make an empowered choice. So hopefully that helps. And then,
fantastic.
You know, my son, for example, knows that ice cream is going to make him feel sick. So he chooses a lot of times not to have ice cream, even if it's being offered to other kids, because he'd rather feel good. So
excellent.
There you go.
There we go. That is fantastic.
Oh my gosh. What else?
I think we'll have to wrap for today. Thank you so much, Dr. Pedre. You've been fantastic, and there were so many pearls of wisdom through the whole thing. I think we'll have to.
They're going to have to go back and listen to this again.
Yeah, exactly. Or edit out little.
I threw in so many things in there. You're going to have to listen to, and you have to go watch my TikTok.
Yeah.
Or at least watch it in my stories on Instagram before it disappears.
I will.
We've opened up the chat again now that we're at the end of the interview. So make sure you send your love to Dr. Pedre. This is probably one of the best interviews we've done with you. And so just thank you for your energy. Can tell you've done the work yourself. You're a doctor that's been through the journey.
Yes.
And I think you can see the chat. It's going off, which is awesome.
Awesome. Yeah. Thank you everyone for being here.
Thanks guys for showing the love, and make sure you pick up his book.
Yes. Watch his TikTok. Pick up his
book. It's an amazing book.
And
bestseller.
Follow me on Instagram at Dr. Pedre.
And our new social
media
influencer.
Are you taking any virtual clients?
Yes.
There was a question around virtual clients.
You know, I'm sort of limiting things right now because I'm working on something really big. So I'm trying to keep it to just a few couple of concierge patients, but I have a nurse practitioner that I've trained, works with me, and she can see patients virtually in our practice.
Cool.
So
great.
If not me, they can get someone who has been like handpicked and trained by me, who's also functional medicine certified practitioner. So
wonderful.
Awesome.
I wish I could be here for everyone individually, but I really want to be here like this, to help the many. This is where I feel passionate now.
Yeah.
Awesome. So
now
thank you again,
the love
everyone.
in
Thanks
the
for being
chat
here.
for you. And
I know. I
we
see
really
that.
value.
It's like
even compliments for your skin.
Oh wait, are you going to
skin?
but
it's
before
a
you sign
Zoom
off,
filter. It's a Zoom filter.
and so you have to serenade us in Spanish. Remember,
oh
just
yeah,
as
you
you
said
finish.
you would.
Oh my gosh. Oh.
Come on, everybody, give him some encouragement.
Oh my
We want the
gosh.
Spanish.
I had to think like, what is the song? Now I'm gonna lose the words. Oh.
Do it.
Yeah.
See, the chat's
okay.
demanding.
Yeah.
Piel canela. Wait. Let me look up the words for a second.
It sounded good to start with. People and the chat is blowing up with requests of this.
Are they blowing up?
Yeah.
With stuff.
If this was in real life, they'd be stamping their feet and chanting Pedre.
Okay, so I'm gonna lower this.
The cinnamon song.
The cinnamon song.
This is ojos negros, piel canela, que me llegan a desesperar. Me importas tú y tú y tú y solamente tú.
Yes. Everyone, a round of applause.
Bravo.
That is a first for a Q&A,
yes.
and the crowd is going wild.
Oh, my cheeks hurt. I'm smiling.
And that was not my best singing voice. I wasn't like,
that was a bit of pressure.
I'm sitting down. I got like,
it was an auditorium with 300 people. You got to randomly serenade them in Spanish.
Oh my gosh.
Easy.
Oh, someone's asking, what do the words mean? So I'll do that before we sign off. It means ojos negros is black eyes, like dark eyes. Piel canela is kind of like my skin, olive skin. That que me llegan a desesperar, which take me to the point of desperation.
Ooh.
Because you matter to me.
Oh.
You do. You do.
Oh,
and only you.
Oh.
Yes. What a way to end the call.
Oh, so wonderful. We'll hang out for a bit longer with everyone, but if someone wants to get in contact with either yourself or your nurse practitioner, what is your website, Dr. Pedre?
Yeah, for my office, it's PedreMD, PEDREMD.com. And for anything Happy Gut related, it's happygutlife.com.
Awesome. I'm just putting that in the chat as well.
And come follow me on Instagram.
And TikTok.
I'm just starting my TikTok, so I need some followers over there. So.
Awesome. Well,
you might just have to get a TikTok account just to follow me.
Yes. Yes. Well, someone said they watched your TikTok already. So that's great. And Gail says, Dr. P, you've got this with the TikTok. You got this.
Someone says only if I'm going to sing in TikTok. She put it
in Spanish.
Maybe I have to do a song.
Carol.
Maybe I have to do something.
You play piano, don't you, Dr.
I play
Pedre?
piano. That'll have to be another time, guys. Yeah. I play Afro-Cuban on the piano.
Ooh. Cool.
Amazing. That's so cool.
All right. So I'm putting in the link for your Instagram.
Oh, someone's giving me love. They're saying, and you, et tu.
Et tu.
Aww. Judy, thank you. That was awesome.
Beautiful.
Thank you.
Shani says going to go buy your book now.
Happy Gut. Always a pleasure with you guys. Love working with you. Always love supporting you and participating in the things you put together. So thank you for having me tonight.
Oh, it's our honor. Thank you so much.
Stay safe there in New York.
Yes.
And hopefully.
And we'll keep us posted on these
big things. When are we going to be able to see each other again?
I know. It was a while since we had dinner in New York.
Yes,
seems like the world has changed.
Yeah.
Little did we know. Like it was like that was like another chapter of life. Like now we're like in this other like post-apocalyptic chapter now.
What even? Cool. Well,
awesome.
thank you so much.
Lots of love and sleep well.
Yes.
Same to you guys. Have a good night.
Yes, we will. We're hanging out for a bit longer. Cool.
Okay.
Catch ya. Oh, how great was that? I loved that call. So many golden nuggets and his emphasis on just getting those basics right and how important they are, and that foundation that you can go from. And he's so lovely. And I can't believe he sung to us. That was amazing.
Yeah. And don't underestimate that first 15 minutes of the call.
Yes.
Like after seeing so many people go through this program and all of that. And it was so cool. It reiterated basically what we've been saying. But that first 15 minutes was gold. Yeah. Like, it's huge. So I hope you guys had a lot of fun. We had fun. We love hanging out with you guys. You're awesome. So we love you guys heaps. And so please stay active in the group. If you're trying to implement these things, now is the time.
Yes, that's
Just take that imperfect action.
Do those action
post
points.
Up what you're eating.
Yes, I'm getting lots of messages on Instagram, which is great, of community members that are showing us, tagging us in on the food they're making from our recipes or just things they're learning, which is great. And I've been reposting those as well. So it's a great way to encourage each other. And it's great for us to know too, which recipes you love, and also like what action you're taking. I think it's just all the things that just help each other.
Hang out, have fun, absorb it. It'll change your mindset slowly but surely. And this is what it's all about. You'll slowly learn and you'll become an agent for change, which is the whole vision of Goodness Lover, you going out there and doing it yourself. So lots of love.
Wherever you are in the world, good morning, good evening, and good night. I hope you have a great Friday or great weekend where you are in the world.